Listen closely, because three separate percentage moves are colliding at the same time: 2.8%, 9.6%, and 10.1%. And the combined impact is going to hit millions upon millions of Social Security beneficiaries right now in a way that's bigger than most people realize. This is not one of those updates that only changes your payment by a couple of dollars and then disappears. This is the kind of shift that can change what you actually have left in your pocket after the month is over. If you live on a fixed income, if Social Security is your main support, if you're trying to stretch a check from one month to the next, this matters. And it matters because these numbers don't move in the same direction. One number represents an increase. The other numbers represent higher costs that come out of your check. When those costs climb faster than your benefit, what happens is simple. Your raise starts shrinking in real life. A lot of people are not fully aware of what changed for 2026, and that lack of awareness is exactly how people get caught off guard. They see the word increase, they expect to feel relief, they expect breathing room, then the deposit hits, and the amount doesn't look like what they imagined. Some people immediately think something is wrong. Some people think the COLA didn't apply. Some people think Social Security made a mistake. But in many cases, the explanation is far less dramatic and far more frustrating. Your COLA is there, but Medicare is taking a bigger bite at the exact same time. So in this report, I'm going to walk this through carefully in a clear, news-style way. No panic, no exaggeration, no confusion. Just the numbers, what they mean in real dollars, and what you should look for in your benefits and deductions, so you can plan instead of guess. Let's start where most headlines start. The 2.8%. That 2.8% is the Social Security Cost of Living Adjustment, the COLA. This is the baseline increase being applied to monthly benefits. It affects roughly 75 million Social Security beneficiaries, which is an enormous number. That's not a niche update. That's tens of millions of households who are counting on every adjustment to help cover the basic reality of higher prices: food, rent, utilities, transportation, and medical costs. And the question that keeps coming up is, who gets it? The broad answer is that Social Security beneficiaries receive the COLA adjustment. The COLA applies across the program's benefit structure, and related benefit groups and aligned programs also experience annual adjustments connected to these changes. The important takeaway is that this isn't a limited, select group increase. For the vast majority of beneficiaries, the COLA is applied automatically. You don't apply for it, you don't request it. It's part of the annual adjustment process. Now, what does 2.8% feel like in real life? It depends on your benefit amount. If your monthly benefit is modest, the dollar increase will be smaller. If your benefit is higher, the dollar increase will be larger. For many people, 2.8% might translate to something like $50 per month, $60 per month, maybe $70 per month. Again, depending on your exact benefit. For some, it's less. For some, it's more. But in general, it's enough for people to notice and to expect at least some relief. But this is where the story shifts, because the COLA is only one part of what changes your net monthly deposit. The amount you receive in your account isn't just your benefit, it's your benefit minus deductions. And the biggest deduction that increases for many seniors is Medicare Part B. That brings us to the second number, 9.6%. That 9.6% figure represents the Medicare Part B premium increase for 2026. And this is where the mismatch becomes impossible to ignore. Social Security COLA is 2.8%. Medicare Part B premium increase is 9.6%. That means the cost being deducted is rising much faster than the benefit is rising. So even though you technically received an increase, a portion of that increase is effectively being taken away the moment the new premium is applied. Now let's translate that 9.6% into real dollars, because this is what people actually feel. The Medicare Part B premium increases by $17.90 per month, from 2025 to 2026. Over a year, that's over $200. And if you're living on a tight budget, $200 isn't spare change. It can be the difference between paying a utility bill on time or falling behind. It can be the difference between filling all prescriptions or delaying one. It can be the difference between stability and stress. Here are the official monthly premium figures you need to know. In 2025, the standard Medicare Part B premium was $185 per month. In 2026, the standard Medicare Part B premium becomes $202.90 per month. That is the new baseline standard premium figure, $202.90. And here is the detail that catches people off guard. For many beneficiaries, the Part B premium is automatically deducted from the Social Security payment. It's not something you see as a separate bill you pay later. You feel it directly as a smaller net deposit. So when someone says, "I thought my check was supposed to go up, but it doesn't look like it did," a big part of the time, the answer is, it did go up, but Medicare increased too, and Medicare is pulling money out faster. Let's make that real with a clean example. Imagine you receive $2,000 per month in Social Security benefits. A 2.8% COLA on $2,000 is about $56 more per month. That sounds like progress. It sounds like relief. It sounds like at least a little extra room. But now factor in Medicare Part B. Your Part B premium is rising by $17.90 per month. So out of that $56 increase, you lose $17.90 right away. That means your net increase isn't $56. It's closer to $38. And that's only the Part B premium. That's before we even discuss other changes, other plan premiums, other healthcare costs, or the third number that is also moving upward at the same time. Now we move to the third figure, 10.1%. That 10.1% number represents the Medicare Part B deductible increase for 2026. This matters because it's not only your monthly premium that's rising, the deductible is rising too. So you are paying more each month. And you also have a higher out-of-pocket threshold before Medicare Part B coverage begins, paying for certain services. Here are the deductible figures. In 2025, the Medicare Part B deductible was $257. In 2026, the Medicare Part B deductible becomes $283. That is a $26 increase, which equals roughly a 10.1% jump. Again, look at the pattern. COLA, 2.8%. Premium increase, 9.6%. Deductible increase, 10.1%. If you're a senior trying to make sense of why things feel tighter each year, this pattern explains a lot. Health-related costs, especially Medicare-related costs, keep rising faster than the Social Security adjustment that's supposed to help cover inflation. Now, some people hear $26 deductible increase and think, that doesn't seem like much. But it matters because it adds to a stack. And with fixed incomes, stacks add up fast. Let's do the combined annual math clearly so you can see what's happening. The monthly premium increase is $17.90. Multiply that by 12 months. $17.90 times 12 equals $214.80 per year. Add the deductible increase of $26. That totals roughly $240.80 more per year in Part B costs alone. And this is only Part B. It does not include Medicare Advantage costs if you're in that type of plan. It does not include Part D prescription plan premiums. It does not include Medigap premium changes. It does not include co-pays, co-insurance, and other out-of-pocket expenses. It does not include increases in prescription prices or the costs of services not fully covered. It is simply the baseline Part B premium and deductible shift. That's why a senior can hear 2.8% COLA and still feel like they aren't moving forward, because the bigger costs are rising faster and they are being deducted automatically, quietly, month after month. Now let's address the real-world experience many people have during the first payments of a new year. A common situation is this. You hear about the COLA. You know your benefit should rise. You estimate the increase. You expect to see the deposit jump. But then you look at the actual deposit and it doesn't match your expectation. For some people, the deposit goes up, but not by as much as they hoped. For others, the deposit appears almost unchanged, and that moment creates confusion. Here's the clean explanation. The COLA is applied to your benefit amount, but your Medicare Part B premium deduction is also increasing, and that deduction can offset a big portion of the COLA increase. So yes, you can get a raise and still feel squeezed. Now, it's also important to be honest about what the COLA is supposed to do versus what it actually does for many seniors. COLA is designed as a cost of living adjustment. In theory, it's meant to help benefits keep pace with inflation. But the reality many seniors face is that the inflation measure used to calculate COLA doesn't always reflect the spending patterns of older Americans. Social Security COLA is based on an inflation index tied to urban wage earners and clerical workers. Seniors, however, tend to spend a higher percentage of their income on healthcare, doctor visits, prescriptions, insurance-related costs, medical supplies, and related services. And healthcare inflation has a long history of moving faster than overall inflation. That means a COLA can be correct by the formula and still not match the real inflation pressure seniors experience. That's why you hear so many people say it doesn't go far enough. And there has been a long-standing conversation about changing the index used to calculate COLA to one that better tracks senior expenses. One commonly discussed option is the CPIE, the Consumer Price Index for the elderly. It is designed to track inflation patterns more closely aligned with older populations. If Social Security used a measure like that, many seniors would likely see larger COLA increases over time because healthcare carries heavier weight. But here is the reality. The system has not been changed to use CPIE. It has been proposed multiple times, and it has been discussed repeatedly, but it has not been enacted. So for now, beneficiaries are dealing with the current structure. And under the current structure, we have a 2.8% COLA for 2026, alongside Medicare Part B increases of 9.6% for premiums and 10.1% for the deductible. So what should you do with this information? This is where practical steps matter, and this is where you can protect yourself from surprises. First, confirm your updated Social Security benefit amount for 2026. Many beneficiaries receive a notice from the Social Security Administration that outlines the updated benefit amount. If you didn't see it, or if you're unsure, you can verify your benefit figure by checking online through official Social Security resources. Knowing the exact updated number is important because it lets you compare expectations against what actually deposits. Second, know the Medicare Part B premium baseline for 2026. The standard Part B premium for 2026 is $202.90. If you are paying the standard premium, that is the number you should expect to see deducted. Some beneficiaries may pay different amounts depending on their circumstances, but for the standard premium group, that's the key figure. Third, understand the Part B deductible for 2026. The Part B deductible for 2026 is $283. That's the out-of-pocket amount before Part B begins covering certain eligible services. This matters when you plan early year medical visits, because many people hit the deductible during the first part of the year. Fourth, watch your first payments and compare them against your updated benefit notice. Mistakes are not common, but they can happen. Sometimes deductions are misapplied. Sometimes changes take effect and confuse people. If the amounts look wrong, if something feels out of line, do not ignore it. Addressing questions early can prevent bigger problems later. Fifth, check any additional plan premiums if you have them. Many seniors have Medicare Advantage plans or Part D prescription drug plans. Those are separate from Part B and can carry their own premium changes. If your private plan premium rose, it can further reduce your net monthly amount. It's important to know your total healthcare cost picture, not just Part B. Now, a lot of seniors ask a hard question. Can I do anything about these Medicare increases? If you want to keep Part B coverage, the premium is generally required. That's part of how the program operates. So, in many cases, You do not have the power to prevent the Part B premium increase, but you do have power in other areas, and that's where strategy matters. You can review your Part D prescription plan to make sure you're in the most cost-effective option for your medications. Plans change every year. Formularies change, premiums change, pharmacy networks change. If you're not reviewing your coverage, you could be overpaying without realizing it. You can talk to your doctor about lower-cost alternatives, including generics where medically appropriate. You can ask about therapeutic alternatives if a medication is expensive. You can ask whether a mail-order pharmacy option reduces the cost. Sometimes small changes make a big monthly difference. You can use preventive services covered by Medicare at no extra cost, which can help catch issues early and potentially reduce bigger costs later. Preventive care doesn't fix premium increases, but it can reduce unexpected medical expenses. And beyond healthcare, you can look for ways to protect your overall budget. That can include looking for senior discounts, exploring utility assistance programs, checking for local or state resources that help with energy or property taxes, and reviewing recurring monthly expenses to find any areas where costs can be reduced. For some households, even trimming a few expenses can stabilize the monthly budget enough to absorb higher healthcare costs without falling behind. Another question that comes up is, will this get worse over time? The honest answer is that Medicare costs have been rising for years, and the trend has been that Medicare increases often outpace Social Security COLA. That doesn't mean the exact percentages will always be the same, but it does mean the pattern is not new. Seniors have been feeling this squeeze for a long time. The result is that many beneficiaries gradually lose purchasing power even with annual COLAs because the costs that matter most, health costs, keep rising faster. This is why planning matters. A lot of people try to manage month by month, and that's understandable when money is tight. But awareness of these changes allows you to plan a budget with accurate numbers rather than hoping the deposit will cover everything. So if you are making a budget for 2026, build it on real figures. Build it knowing your benefit amount after the COLA. Build it knowing the standard Part B premium is $202.90 if you are paying the standard rate. Build it knowing the deductible is $283. And remember, Part B is only one piece of your healthcare expenses. Now let's talk about one more practical issue that often hits seniors early in the year: confusion around the first deposit. Many people expect the first deposit to reflect only the COLA increase. But if your Medicare premium deduction increases at the same time, your net deposit might not look very different from last year's deposit. That can create a dangerous misunderstanding. Some people assume Social Security made a mistake. Others think they need to take action immediately. And that's where scam risk can rise, because scammers love confusion and uncertainty. So here is a key protection tip. Never respond to unexpected calls, texts, or emails claiming they can fix your Social Security deposit. Official agencies do not ask you to confirm sensitive information through random outreach. If you need to verify anything, use official contact methods and official websites you already trust. Now, if you are struggling to afford Medicare costs, there are programs that may help. There are Medicare savings programs that can help eligible individuals with premiums and cost sharing. There is also the Extra Help program for Part D prescription costs. Not everyone qualifies. Eligibility depends on income and resources. But if you're in a position where you're choosing between medical care and other essentials, it is worth looking into these programs and seeing whether you qualify. And when it comes to benefits, it's important to remember that every situation is different. Some people have higher benefits, some lower. Some have additional deductions, some fewer. Some pay additional plan premiums, others do not. So your experience can differ from your neighbor's experience, even if both of you are Social Security beneficiaries. That's why it's important to look at your own numbers, look at your own benefit amount, look at your own deductions, look at your own healthcare premiums. Then build your budget from that real data. Now, let's take a minute to summarize the three headline changes in a way that sticks. The 2.8% COLA increases your Social Security benefit. The 9.6% Part B premium increase raises the standard monthly premium from $185 to $202.90, which is $17.90 more per month. The 10.1% Part B deductible increase raises the deductible from $257 to $283, which is $26 more. When you combine those two Medicare increases, Part B costs rise by roughly $240.80 per year compared to last year, just from premium and deductible changes. That's why the net gain from the COLA is often smaller than it looks. Now, let's address the emotional reality, because this isn't just math. This affects real lives. For many seniors, a Social Security check is not a bonus. It's the foundation. It's rent. It's utilities. It's food. It's transportation. It's medication. And when the system gives an increase with one hand, but raises costs with the other hand, it creates stress. It creates frustration. And it can feel unfair because seniors have already paid into the system for decades. But the most powerful thing you can do is stay informed and plan ahead. If you know what's changing, you can avoid surprises. If you know what's being deducted, you can set expectations. If you know your net amount, you can budget more accurately. And accurate budgeting, especially on a fixed income, can be the difference between stability and monthly chaos. So here's a clear approach for the coming weeks. Check your updated Social Security benefit amount. Review your deposit amounts carefully. Confirm the Part B premium deduction you see matches the 2026 standard premium if you pay the standard rate. Be aware of the deductible increase when scheduling early year medical visits. Check any private plan premiums you pay, such as Part D or Medicare Advantage. And if your budget is tight, look into assistance programs to see if you qualify. This isn't about fear, it's about control. It's about seeing the numbers clearly and responding with planning instead of panic. Because 2026 is bringing changes, and when you're on a fixed income, changes land harder. Now, if you're hearing this and thinking, I'm already stretched, what now? The reality is that you may need to treat your budget like a living document this year. Keep a close eye on recurring expenses. Review your insurance costs. Look at where money is leaking out quietly. Subscription services, rising utility costs, small monthly fees. Sometimes finding and cutting a few small things can offset a premium increase enough to protect the essentials. And if you can, build a small cushion for health care